Welcome, everybody. Thank you to tuning in today and obviously watching our podcast. Today's podcast, we are going to be exploring a life down under, so what working as a GP in Australia is like. And we're very fortunate to have a really prominent GP from Australia, a chap called Chris Jones, who has actually made the transition from the UK into Australia, coming up now about 16 years. Is that right, Chris?
Yes, I arrived on the 1st of August 2008 with my family. So, yeah, 16
Wow.
years, long time.
Wow. Wow. And what myself and Chris are going to be covering today is we're going to be going through a little bit around obviously what working in Australia is like for individuals, what to really expect, kind of giving a bit of a comprehensive overview on working as a GP, partly touching into some of the lifestyle, going through some of the healthcare system itself, and obviously things to kind of consider and the benefits, obviously, of working in Australia. So to kind of start with, obviously, Chris, you mentioned that you made that transition, coming up 16 years, obviously with your family. I guess it's worthwhile asking, really what kind of led you to make that move? What actually caused you to think Australia is going to be right for me? I want to leave the UK.
Yeah, so look, I was in the NHS. I qualified way back in 86 in London, and I was a GP in Poole as a partner for 7 years when I made the move with my wife and kids. And at the time, they were 6 and 7 when we moved over. So the year before, NHS had been struggling more and more. I was working harder, treading water, and getting disillusioned is a polite way of putting it. And I was looking at different options. And I've been to Australia on holiday a few times, and I've always liked or envied the relaxed and outdoor lifestyle. So
Yeah.
we made the move and applied for a job through a recruitment agency to move to Australia. So that was back in 2007 September, and I was in position by 1st of August 2008.
Wow. Wow. It sounds like there's a lot of reasons. Obviously, as you say, the healthcare system in the UK was struggling a little bit. Obviously, if we compare that to now, I think there's a lot of people that are in that same position that are
Yeah,
thinking, things have got slightly worse, to be polite, as you say, and they're also now thinking about making that transition themselves.
yeah,
So I think this is going to be a really good insight for them
sure.
to obviously be able to tune in and find out obviously a little bit more on why they should make that move.
Yeah.
And Chris, obviously, one thing I always like to ask is, any regrets, in regards to making this move? Has Australia been the
No.
right thing for you?
Oh, for sure. I mean, I'd like to have done it earlier, but my kids were very small, and family wanted us to stay local in the south of England. So, no, it was the right time for all of us to make the move, really.
Yeah, yeah, wow, wow. So I guess obviously a lot of the questions that our listeners will kind of have is really what is it like being in Australia? What is it like working as a GP in Australia? How does it differ to things in the UK? So if you're happy, just to give us a bit of an overview, a bit of a overview on what your working days are like, what working in Australia is like as well.
So I'm full time. I work in a 10-man practice. We used to have trainees, but we don't have them anymore. And all of the GPs who I work with, some are part time, some full time, some work in other areas as well. And as I said, I work full time. I'm contracted for 45 hours a week, 40 weeks a year, which means I take 12 weeks leave a year, um, which is slightly more than I had back in the UK. But the good side is that I work hard and play hard and travel lots. The downside is in that 12 weeks, because I'm not seeing patients, there's no money coming in. So you have to weigh up the money that you're earning while you're at work against the money you're not taking in when you're traveling or on holiday. Um, but I work very flexibly. As I said, I'm full time. So my week is I work um, Monday, Tuesday, Wednesday, Thursday, Friday, and Saturday morning. And I start work at 6:30 in the morning, which is quite weird for people in the UK, but 6:30 till 1 on Monday to Thursday. So I'm seeing
Okay.
patients all that time. And then Monday, Wednesday, and Thursday, I come back at 4 till 8.
Oh wow. So breaking up your week, your
Yeah.
days completely in that case.
And then Friday, I come in at 10 o'clock in the morning till 1, 3 hours. and Saturday I do 6:30 to 11. And what I
Okay.
do, so on my afternoons, every afternoon I've got either on a half day or I'm off. I'm quite sporty, so I'll either be down at the beach, kite surfing, swimming, or running, or with my wife. And it works well for me because I tend to work hard when I'm seeing people, and then I can quite relax. I can take 3 or 4 hours off in the middle of the day, do what I want to do, and then come back quite happy to see the evening shift. And that works well for myself, my wife, and my family because it keeps me happy, keeps them happy as well.
Yeah. No, of course. And it provides that better work-life balance ultimately as well, doesn't it, for yourself?
Yeah, I mean, some people. I don't play golf, but some people love playing golf. So if you were a golfer, you could play golf as much as you wanted. Other people like horse riding or just chilling with a family. As I said,
Yeah.
I love my sports and travel, so it does work well for me because that combination. I don't get bored, I don't get tired, and I'm actually look forward to going to work. Which, having been a GP for so long now, not many people, certainly back in the UK, who I talk to, can say, "Listen, I'm looking forward to coming to work Mondays because there's a challenge there." And the
Yeah.
patients are the same as they are in the UK. We're all the same. They're rich and poor, young and old. It's a
Yeah.
usual mix. And in our centre, of the 10 doctors, 6 are Filipino, two
Okay.
two are English, myself and the other chap, and then we've got the token Australian, one Australian doctor, and an Irish doctor. So yeah, so it's very varied. And the team, we've got 3 nurses, 2 which are ENs and one's an RN, and we've got in-house phlebotomy from 7 a.m. till 3 p.m. Monday to Friday with 2 phlebotomists.
Wow.
So we have quite an intensive team, but we don't have, which I miss from the UK, we don't have health visitors and we don't have district nurses.
Okay.
So that's a different structure. District
Yeah.
nurses are sort of a private fund that if you need district nursing care, you have to pay for, which isn't great. And the health visiting system is clinic based, and there isn't very much communication back with the family doctor, which is which is a shame, but the way it happens.
Yes. Yeah. It's just slightly different to the
Yeah,
way that things are obviously here in the UK. But it sounds like you're surrounded by a great team, a very experienced team, very
yeah.
kind of
Well, the other thing is that all the doctors and the nurses and the admin, they've been there a long time. There's not a great turnover of staff except for retirement or pregnancy.
yes.
People stay. As I say, I've been there 16 years. One of the doctors has been 24 years in the same clinic.
Wow.
So,
Wow.
it's a good mix. And
That's got to show something to job satisfaction ultimately as well,
it does, yeah,
because that doesn't happen really in the UK too much.
sure.
So yeah, wow. It sounds, and as you say, it sounds like there's a big diverse of patients that you see as well. As you
Yeah.
mentioned, obviously from slightly less less well off and very very wealthy that come in
Right.
as
That's
well.
the same as, if you're in any big town, because I'm on the Gold Coast. So you've probably heard of Surfers of Paradise. I'm 10K north of that. So it's a big town, big city.
Wow.
And you have the whole range of people.
Yes, no, completely get that. And one thing that we oh yeah, I've personally experienced as well is obviously the admin technology, the actual kind of facilities that are inside a medical center in Australia. We call them medical centers rather than just a GP
Yeah,
practice.
yeah, yeah.
Are you able to elaborate a little bit more around that on a first-hand level
Yeah.
some
Okay.
of
So
our listeners?
we're paperless, but even so, even though we're paperless, I go through a ream of paper every week, which is annoying. But all my type on my notes, obviously, and all my referrals, if it's the public sector, they're on template to the public system, and you can't proceed with sending with the referral until all the boxes are ticked. So you have to include all the pathology, the relevant history, before you can actually send it, and then you send it to the whichever hospital you're going to. You get an email back saying it's been received, and the patient gets a text the following morning saying the GP's referred you to the service. It's being triaged. You'll hear within 5 days about the outcome.
Okay,
So that's one thing. Um,
it's a lot quicker in that case.
yeah, there's a much bigger use of the private sector here. So if you've got, let's say you've got a hernia, and we worked out you've got a hernia that needs repairing, I'll say, we'll refer you. Do you want to go public or private? And about a third of people say I'll go privately. Now, to go privately, you don't have to have private insurance. You can actually pay however much it costs.
Okay.
Um, but I think about 20%
Yeah.
of people have private insurance. So the NHS in Australia is called Medicare, and that's free at the point of service, like the health service.
Hmm.
So doctors are paid by Medicare, and that's called bulk billing. And because of my left wing views about health, I bulk bill all my patients. So um, other doctors, GPs, and specialists will privately charge. So they get the whatever the money for the services provided by Medicare. Let's say $100, they'll charge another $100. So there's this thing called a gap.
Yes.
So with the referrals, if I send you to a private sector, and you've got private health cover, you pay like a top up. But if you don't have private cover, then you pay the full fee.
Okay.
So it's a bit novel to what I've been used to in the UK, um, but it works.
Yes.
Um, we've got the same type of problems as the health service, with waiting lists in the public sector. Referrals are categorised, triaged into 1, 2, and 3. So 1 is life and limb threatening or cancers, 2 is urgent, and 3 is routine. So let's say you need a hip replacement. I send you publicly. You could be on the wait list for 3 years, which is not good.
No.
And that all depends also on what catchment area you're in. So if you're in a large city with lots of hospitals, it could be lower. Um, but I think that the public sector hospitals, that they're good, they're well staffed. Most of the junior and middle grades are all English or Irish. So many of them are doing their rotations to get specialist qualifications. And I think that the overall satisfaction with the public sector compared with what it is in the UK is higher.
Yeah.
I might be biased because I've been here for so long now, but um,
No.
I
I
think
think
it
I
is.
think I think you bang on obviously with that, because even the services that are offered as well. There's a wide range of services that are facilitated, by
Sure.
GPs that aren't dealt with by GPs here in the UK. They've got
Well, yeah. Well, I do a lot of
access to
breast
things
cancer
like
work.
pathology and
Yeah.
radiology and things, isn't there?
Well, I was going to say I do a lot of breast cancer work, and if I saw a lady in the UK with a breast lump or suspected breast lump, the old protocol was I'd have to do a referral to the hospital within 24 hours as a suspected cancer,
Yeah.
and the hospital would have to see the lady within 2 weeks, I think, and then the ball starts rolling slowly.
Hmm.
But if she comes to me here, um, I'll get her imaging, mammogram and ultrasound, and that's no fee for most centres. If it's negative, it's all happy days. If it's positive, I'll explain that she needs a biopsy, which is again, I refer to the same centre a few days later.
Okay.
And if the histology comes back as positive for a cancer, I then request a staging CT. So that we can then have a chat, sit down together and say, okay, look, you've got a breast cancer. It's this type of cancer. It's localized. Now we need to send you to the specialist to do their bit. And what would you like me to do? Again, public or private? Now, if you go to the public sector with cancer, brilliant service. If you go to the private sector, equally brilliant service. So you're as a GP, I can really sort out the patient before they go and see the hospital specialist, which is
Yeah.
it's great satisfaction because you feel much more involved with the patient, and then when she's come back from her surgery or started radiotherapy, you then sort of take part in the aftercare,
Yeah.
which
Wow.
for me is good because I love it.
Yeah. You're a lot more involved, aren't you,
Yeah,
as
yeah,
in Australia, in comparison to
yes,
here. And you can facilitate and actually look after, a patient to a much higher kind of standard. I guess that's why Australia is ranked as that, top three healthcare systems,
yeah,
globally to start with. But you are just being able to kind of look after the patient, gives that better job satisfaction, but that better patient care at the same time.
yeah. And I think it's all about speed as well. You can get things done. You have to be pushy sometimes to get tests done and make phone calls. But if you're keen to get involved and care, you just you just move things along.
Yes, yes, that's one thing that I've experienced as well firsthand is that, you know obviously it depends on the practice, but some of these practices have got the ability of, getting somebody in, having, let's say blood's taken, and having the results, almost turned around very quickly
Yeah,
to,
yeah.
get the results back with, sometimes even within a matter of hours, aren't they? Where
That's kind of normal. So I mean, for our bloods, if I do a set of bloods on you, you're now 60, and we're going to do your routine annual blood, your cholesterol, your prostate, whatever, your liver and kidneys. I'll see you this. I'll see you today. I say we need to do a fasting blood test. Um, if you fasted, that's great. Do it today. If you haven't, do it tomorrow. And then
yeah,
I'll say I'll phone you 2 days time with the results. So I'll book you for a phone consultation, which Medicare will pay me for. And I'll talk about the
wow,
results when as soon as I get them. I'll give you a call, and then a telephone consultation, discuss the results and any management or treatment needed. So you can get everything going so much faster.
yes, yes, and that's think these little things like that that stand out a lot, in comparison to here in the UK. Last time I went for bloods myself, I think it was maybe 5, 6 weeks before the results even came through. I'd actually forgotten that I even had bloods taken when the doctor called me up. I was, it's a long process where obviously in Australia things can just, as you
But
say,
yeah.
get done a lot more kind of proactively.
Well, the other
Is
thing is with the results and follow up, especially with COVID. When COVID came, we couldn't see patients for 3 or 6 months, and everything was done on the phone, and there was a fee was paid for these phone calls. And now I'm just looking at my bits today. So this week I've seen 162 patients, and I've made 31 phone calls this week, and that's kind of an average week. So 31 phone calls, and Medicare pay me for these phone calls, which is good care, and I'm being paid for it, so I don't mind doing it.
of course, of course. Wow. Wow, that's it's very different to the UK, and I think we'll come on to the earnings and the way that the earnings are kind of
Sure.
overall, kind of work out in just a couple of minutes. But I guess from where we're up to, and whilst we're talking about working as a GP, it would be worthwhile just asking you to kind of run us through. I know you've given us a couple of bits about the hours, but just run us through a typical day, or for yourself, for example, or maybe just a general for a GP.
Well, so as I said, my first patient's booked at 6:30 because I
Yep.
love getting up in the morning. I get up at 5 and either take the dog out or go for a run, whatever. So
Hmm.
first patient's at 6:30. Most clinics locally will open at 8, but our place opens at 6:30, and three of us are working at that time.
Okay.
And our nurse comes in at 7 o'clock. So I've got my booked patients now. As I said, I bulk bill all my patients because my views on access to um, good quality healthcare, which you don't have to pay extra for. So 90% of my patients are regulars. So they're known to myself mainly, or the other doctors there. So we have all their notes. We do accept walk-ins, and again, we don't mind having what's called a walk-in, an extra patient, because again that attracts when you're working, you don't mind working for being paid for it. What you don't like doing is doing a job, finishing a job, and there are four more patients to be seen in the waiting room and you want to go home. But if you're actually being paid for it, you don't mind so much. So anyway, so get in 2 minutes before I have to start work, get my first patient in, and the notes are good because there's a summary sheet with the major things that he or she's got wrong with them, and hopefully the last consultation that I did or the other doctor did will tell me what we're doing today, unless it's a new problem. And I work through till 1 o'clock, which is a long
Okay.
time. Um, but when you know that you're going to be away at 1 to do your other stuff, it's fine for me.
Yeah.
I then finish at 1. I go away and either don't come back or come back at 4 o'clock. So, like I say, I do lots of sports. So I'll either be on the beach kite surfing, swimming, or running, or meeting my wife for lunch. Then 4 o'clock I come back, work through till 8, 3 days a week, and go home. And one thing I don't do is I don't bring work home. There's no need to, because I can get because the admin is so limited. We've got all our results come through email, so I can act on them, or phone the patient, or arrange to phone the patient, or just file the results. Same thing happens with our letters from specialists. I can either file them and arrange to see the patient to explain what the specialist said. So nothing comes home with me really. So I finish at 8, 3 days a week. and Tuesdays I finish at 1. Fridays is kind of a 3-hour day, which is not really doesn't feel like being at work. And then I do the same morning. And then, as I said, most GPs will. That's my week is longer than most GPs. Apparently, I was talking to my boss in Sydney. The average full-time equivalent GP is now working 34, 33, 34 hours a week face to face,
Wow.
which doesn't seem that many. And I'm doing 45, and it seems enough. I'm not overdone. I don't feel burnt out by doing that many hours, but it seems that's what I need to do to get my work done.
Yes.
And because I work the longer hours, I take much more holiday. I'm off to Indonesia next in 3 weeks to go kite surfing for 2 weeks with some mates. So, so that's to look forward to.
That's awesome.
Um, and I'm perpetually looking forward to the next thing, which helps get me going.
Yeah. No, definitely. Definitely. I think just going back to that admin side of things, that's a huge difference to what people get and GPs are currently experiencing here in the UK. They've got a mass amount of admin work to do. They are having to
Mm.
take it home with them. There's GPs that I can speak to that are doing an additional up to 10 hours, a week on top of working, maybe 40, 45 hours, just
Yeah.
worth of admin work that they're having to do at home, sat in a
Yes.
room away from the family and things. So you definitely get a much better work-life balance in
Oh,
Australia.
for sure. Yeah.
I think it's worth noting that for some of these UK GPs that are coming in, they are limited to the visa restrictions, so they will be looking at kind of a minimum of about, well, full time about 38 hours. But as you say, once you're out of that visa and obviously start gaining that permanent residency, the full time equivalent is actually a lot less,
Yeah.
miles less than obviously
Depends
what
what,
you get in the UK.
but depends what you want to do as well. So some people want to work part time because they've got other things they want to do. Other
Yep.
people want to work as many hours as they can to buy that big house. But um, everyone's got different aspirations and goals and the way they work. So I
Yes.
think the good thing here is that you can. So I don't do any out of hours work overnight or evenings with the out of hours services, but there's that option if you want to do that. You can work all weekend if you want to and earn more money because the way the system is geared, out of hours payments are higher than they would be during in hours payments.
Yes.
But there are lots of options.
Yes, and I guess it's just kind of gradually taking us into the physical kind of earnings, if you will, really, and as we say, we call them billings in Australia, because if you are doing just the general work, obviously part time
Yeah,
or full time, you can kind of earn obviously not say up to an amount because it does depend on the practice, you bill, what it is that you're billing, the patients that you see and things, but there is that ability of obviously doing out of hours work, having different specialities is obviously another way that individuals can earn
yeah,
an awful lot more money. So I guess, Chris, it'd be great for you to give the listeners and the viewers, a bit of an insight in regards to, maybe how people are earning money
yeah.
in Australia, because
So,
it's not a guaranteed salary like here in
no,
the UK.
it's quite different. So in the UK, when I was a partner in practice, we had our basic practice allowance, and we would see the books for the what the previous GPs were earning and how much you'd get out of that and all the rest of it.
Yep.
Here, everything that you earn is through what we call billings.
Hmm.
So every time you consult a patient or do something to him or her, depending on the length of time and the complexity of it, they're called item numbers, and
Yes.
those item numbers trigger a payment from Medicare. So you can have the shortest thing is a brief phone call, less than 6 minutes, right up to one of the hardest things is a heart transplant. But they've all got these special codes, and then so they're called your billings now. A full time. So when you see a job advertised, say it says I don't know $400,000 a year earnings. Now you don't know what's he talking about. Is that billings or what? So a full time GP in normal practice could expect to bill 500,000. All right.
Wow.
So you bill 500,000 to Medicare and to private providers. Now, out of that, the company or the practice you work for take a percentage of that fee. So my percentage, I take 60% of my billings from the total income. So out of
Okay.
500,000, you would expect to then be paid over the course of a year 300,000, 60%.
Mhm.
And then you have to then obviously pay your own tax. But one thing that we don't have here is you have to pay your own superannuation,
Yep.
and obviously all the medical defence union and registration. But yeah, so if you see a job advertised where it says earnings of 500,000, you need to ask the employer, does that mean billings, or does that mean what my expected pre-tax pay is going to be? Because if you were pre-tax pay of 500,000, you'd be doing a lot of extra work,
Yeah.
because that's $500,000, which is would be lovely. I know a few GPs who do that much, but they're working all day, all night, and doing lots of procedures. But no,
Yeah.
for a full-time person, 500,000 billings is what you would be
Yeah.
expected to
And
take.
I guess as you say there, it depends on the individual. It depends on obviously their skill sets. It depends on what they. A lot of people got different motives for obviously making the transition. So some of them
Sure.
are going for the money. Some of them are going obviously for that much better work-life balance. So
Yeah.
if you are really money hungry, that those abilities are there. But
Yes. Yeah.
typically, obviously, as we're talking here, obviously those earnings are still looking at kind of two, three times what a lot of GPs here in the UK are making.
See, so we moved to Australia for the life. I do a bit of skin cancer work, so I'll do what we call skin checks and take off moles and things like that, skin lesions. I've taken off a couple of melanomas last week, but again, with skin surgery, there are so many codes depending on where the lesion is, the type of lesion it is, how big it is, and how complex it is. So when I take a mole off, all I do is a small ellipse because that's what I've ever learned to do. But other GPs will do flaps and all sorts of complex procedures and grafts. And if you do that sort of work, the fee that attracts goes up tremendously. So some
Wow.
GPs will just work in skin cancer clinics and will then be earning an awful lot more. But again, that for me, that's a subspecialty that is interesting, but I wouldn't want to be doing that day in, day out. The great
Yes.
thing about GP land for me is the variety, you know.
Yes. Yes. And I think we've given obviously a bit of our listeners a bit of a good overview there in regards to the billings, and
Mm.
obviously how it comes through obviously the Medicare and the physical kind of earnings, I guess obviously from that respect. And one thing obviously I just want to try and touch on is maybe some of the job opportunities that are available. There's a lot of Australia's, there's no hiding it. Australia does have a shortage of GPs. It's got the opposite problem to here in the UK, where there's a lack of GPs in Australia. We've got a lack of jobs in the UK, which is what a lot of individuals are kind of exploring the opportunities
Sure.
or you know what other opportunities are available.
Mm.
And when they start hearing about the benefits that we've mentioned so far about
Yeah,
working in Australia, it does obviously entice a lot of people.
sure. And so all jobs, it doesn't matter if you're a hospital doctor or a GP, all jobs that are advertised depend on what's called a provider number. So I
Yes,
have a provider number to work in my medical centre, and I've also got many other provider numbers for when I work rurally. But the job that's advertised in Australia, first of all, has to be advertised for I think for 2 months to the national press, medical press, and then if that doesn't obtain a suitable candidate, then they're allowed to advertise overseas. So each job that is advertised is you're tied to that one clinic. Now it may be that there'll be a high demand rurally and in small towns,
yes,
and the closer you get to the big cities like Sydney, Melbourne, Canberra, there are a few jobs that are available to overseas graduates because that's where all the local doctors want to work in the
yeah,
big cities. But anywhere outside 50k outside of the big city, you can easily get a job.
yeah. And with I suppose what Chris is talking about there is the DPA, so the district
Yeah,
priority areas,
yeah,
which is something that I went through with all of our candidates and GPs. And the good thing with the DPA side of things, I suppose, is that the government are constantly reviewing this. So if we were to compare the DPA areas now to the way that they were 3 years ago, it's much better. It's a lot more accessible for GPs to actually work, slightly close to the cities, and there is the ability to actually still, for some areas, depending on what how you're happy to how far you are happy to travel.
Yeah.
You can still work or live in the city itself. The DPA doesn't
Yeah.
restrict any form of where you live, and then maybe travel 50 minutes an hour out of the city
Yeah.
to to work. But what we try and suggest to some of our GPs is try and find that balance. Maybe look in
Yeah.
between. Just live outside the city. You get obviously a little bit more for your money for the cost of living.
Sure. Sure.
And then maybe half an hour one way into the city, half an hour one way to work.
Yeah, it's not far. And Australia's a huge place. I didn't realise that
Oh
when
yeah.
I do my travelling, it takes, when I come back from Europe, we come by plane from Singapore and you hit Australia, Port Hedland, the um, north of Perth, well north of Perth, and it takes 5 hours to get from there to Brisbane, where I live, by plane. 5 hours. So that's the same as London to Turkey. It's huge.
Yes.
So
Yes.
travelling, you know, half an hour to an hour for anything here, well, it's nothing. It's just going to go
No.
down the road.
No. Exactly.
Having said that, my surgery is 15 minutes drive from here,
Very nice.
which is
Very
great.
nice. Yes.
And
Yes.
because I start work at 6:30, the traffic is good. If I start work at 9, then all the kids are at school, people are at office works, so it take longer. But no, with my hours, it's easy traffic.
Yeah. No. Definitely. No. Definitely. And I guess obviously as you keep saying there about obviously your holidays and
Yeah,
being able to go into Singapore and things. A lot of Australians, kind of do go on holiday within Australia because you say it's so different, and obviously you can jump on a plane and travel 5 hours and be in a
yeah,
completely different part of Australia altogether, which it's got a different climate, different lifestyle, different offerings and things.
mm,
But at the same time, a lot of people, you know, would go into the likes of Asia, for example, for holidays, weren't they?
yeah. Well, like my plans for the next 3 months. So I've got my boys' trip to Indonesia. I come back for 2 weeks to my clinic, and I then go to Cairns to work, doing some Indigenous schoolboy work, which I do
Right.
regularly. That's in Cairns. I then come back for a month. I'm then doing a locum with Flying Doctors in Broken Hill, which
Okay.
is about 2,000 kilometres away, middle of nowhere.
Yes.
But again, interesting. Um, and I come back to my own surgery and start work again in October. So, there's so many places to go. And Vicky and I were recently in Rarotonga, Cook Islands for 5 days. And because
Very nice.
these places you want to go to, you go once in your life, um, because it's, transport is so easy, really.
Yes. Yes. And I guess it's that aspect as well for individuals that are wanting to make this move due to obviously trying to gain some experience traveling, or there's not just when I spoke about the motives of the earnings, and some people are there thinking about the work-life balance. Some people obviously are there thinking, I want to try something new. I'd like to obviously be able to explore a different healthcare system, but I also want to obviously do some traveling and things and
Yeah.
explore. And Australia can provide that.
When for me, I wanted to live here. I did my elective in Sydney as a med student. I always wanted to live here, and
Mm,
wasn't until years later that I managed to do it. But some people want to come for 5 years to say they've done it and they've experienced this part of the world, and then come home to Europe, which is fine.
yeah,
Not everyone that comes for an initial job stays. Most do, but some don't. And yes, it's such a great place to come to. I mean, it can be quite challenging leaving England, and all your support networks, and then you've got to rent a house, buy a vehicle, get the kids to school. So that can be a bit daunting, but
yeah.
it's part of the adventure, really.
Exactly, exactly, and we've very nicely just there just gone into when I was going to ask you about things maybe to or your suggestions for individuals that are thinking about making this move or going to make this move
Yeah,
into Australia. What are the main things for them to really kind of take into consideration?
I think it's not going to happen if I apply for a job with you today and you say you've got the job. Um, it doesn't happen overnight. It took me 9 months of form filling, making sure my degrees and postgraduate qualifications had certified copies, that
Yeah,
my postgraduate education was up to date, and everything was legitimate for the Australian medical system. There's that. And then there's, right, we need somewhere to live. So how we do that? So we looked online. We spent about a month looking online for a house rental for 6 months. near to where
Yeah.
I was going to be working, and that took about a month to actually sort out where we're going to live. And then you arrive, and you need a vehicle because we rented a car for a week, and that's expensive. So
Mm.
you need to actually have some funds behind you to say, right, we'll get a car, a vehicle. Um, and then if you've got kids that need schooling, um, I started work on the 1st of August. Our kids finished school, I think the 20th of July in England.
Okay.
So I wanted them to come to Australia for a holiday and then go to school the next term because our academic year starts in end of January. So they
Yes.
join they call them semesters here. There are 4 semesters. So they went into the third semester, I think, in August. And you've got a choice of public or private. Both have got their benefits and their challenges.
Hmm.
We sent ours to private school because a nice private school is half the price of the UK for sure. Literally
Yeah.
half the price. I couldn't, back in England, I couldn't send either of my kids to private school because I just couldn't. But here I could, and yeah, it worked well. But there are all these logistical things of education and transport that you have to think about before you actually get on the plane.
Yeah, yeah. It's as you say, it's a big transition. There's a lot to kind of set up. It's like setting up obviously a new life in
Yeah,
a new country, but there's a lot of support. There's a lot, the people in the community. I think from what I've personally experienced with GPs that have made this transition and made this move, you know, they get a lot of help from people. The community want to try and help out. The Quite often you've got the likes of obviously ourselves as recruiters that want to help
sure.
out, but then you've also got the clients that you're moving to that want to give suggestions and want to try and obviously
Yeah.
make the move as seamless as possible. And even as Chris was saying there with the paperwork side of things, the registration and the visas, that's something that you get full support. I've got individuals on my team that will quite literally guide you on a step-by-step basis through the registration, through the visas, to make sure that everything's getting ticked off. We're working obviously, efficiently and proactively. These things do take time. There's no exams, but it is time consuming. And a lot of it is just waiting to hear
Sure.
back from when you submit a document. It can take 5, 6 weeks plus for them to even come back to you.
And that's a good thing about the exam business because I had my MRCGP, and that's recognised as an equivalent to the
Yeah,
FRACGP, so the Australian College of General Practitioners.
yeah,
Whereas if you come from another country, I've got my Filipino colleagues have got their postgrad qualification in the Philippines, which isn't recognised here. So they've then got to sit exams, which apart from costing money, stressful and will I pass and how many times can I do it? It can be
yeah,
delaying. But if you're from the UK, you know, general practice training is highly respected around the world from the UK, and you can slot in here very quickly.
yes, yes. And that's something that I've personally experienced as well. Um, no, awesome. Awesome. Well, Chris, obviously, I think we've given a really good insight for a lot of GPs that are wanting to tune in, wanting to listen, and hear what working in Australia could be like. What it could be involved, obviously, for them. We touched on some of the benefits. Obviously things to consider. We're given an overview on the healthcare system itself. So I really want to kind of thank you for your time today. And is there anything kind of final thoughts that you would like to share?
No, I'm just glad I made the move. If you were to offer me £1 million a year to come back to the UK, I'd come back for a week and then fly back home. No, you couldn't. The medical system for me as a doctor is better than it was in the UK. As a
Yes.
patient, access and service is better as well, which means the outcome for treatment is improved, and it's getting better and more integrated all the time with AI and integrated systems. So no, it's just a great place to live, and people are nice, and they're
Yes.
much more relaxed over here. Everyone is first name terms, from patients to doctors to specialists to lawyers. Everyone is Chris or Tom or whoever, not doctor or professor. It's just a much more equal society.
Yeah. There's a lot more respect, isn't there, for doctors in Australia? There's almost like a level of old school respect.
Well,
Um,
I don't know. I mean, I think every people respect each other. When we came, I enrolled my kids onto Nippers, which is the surf life saving, which is
okay.
a which is a a traditional thing to do on the beach because surf's dangerous and people drown and die. So when we joined the surf club, I would help, and then because I was helping, I was told I had to do my bronze medallion, which is a surf life saving certificate, which is hard work when you're middle aged ish. But as a result, I did the certificate, became a patroller, and then became a the medical advisor for my local club and a trainer. So I did that for 6 years.
Wow.
And all the people you meet on the beach, you might meet, a soccer player who's playing for the national team, or a swimmer, or a builder, or someone who's unemployed, or an and everyone's on first name terms as opposed to Sir, Madam, and it's
Yes.
much more equal, which is great. I
Oh,
love it.
yeah. No, that sounds amazing because we definitely don't get that in here in the UK.
Yeah.
No, that sounds awesome. Sounds awesome, Chris. You're making me want to make that move already. So I'll be
There's always
so.
room for, but apparently there's. I looked on LinkedIn as well. They're always looking for recruiters here as well.
No, I do appreciate that. I do appreciate that. Well, I'll certainly be making you aware when I'm coming over, and we'll have to go out and get some food and go for some drinks and things,
Some
and
beer.
you can take me down to the beach and we can do some surfing and things, and that'll be awesome.
But it's the 22nd of June now, so it's our shortest day yesterday. It's cold in the morning. When I got up at 5, it was 8 degrees, but by lunchtime, no, by 10 o'clock, it's 21. So this is the coldest. And on the news tonight, they've just had their first snow in the Alps. So the
Wow.
snow season here, I think, is only about 6 weeks. It's not very long, but they've had
Yes.
some snow. And as I said, so they've got snow down south, and I'm going up to Kent to work in August. I'm scuba diving on the reef, Barrier Reef, for a couple of days at the weekend when I'm not working. So there's a whole range
Beautiful.
of things you can do.
Beautiful. Beautiful. I love the fact that, as you just say there, it's 21 degrees. I think for our listeners and viewers that aren't aware, it's worthwhile just noting that this is in Australia. It's currently their winter. So when Chris says it's cold, this is their winter at 21 degrees. We're currently in our summer. We've just obviously hitting summer. We're getting some of our warmest days at this moment in time, and we are quite literally. I think today it's saying that it's going to be 22 degrees in
Okay.
summer. So
Well, you've got August to come yet, and September's a good month, isn't it?
Um, but yeah, Chris, I really appreciate obviously your time today and for joining us and just giving this overview for our listeners and viewers. And I also just want to point out that there are other podcasts to come through this series. So we're going to be touching on Medicare in a bit more detail, giving a bit more of a comprehensive overview on Medicare, and just giving more insights, having additional special guests, more insights into individuals that are wanting to make this transition into Australia and making sure that we can give the information for you to hear.